Hi, my name is Linda. This video I shall explain what is reactive arthritis, or previously known as Reiter's syndrome. It is a type of rheumatic disease with complex backgrounds. It is an immune disease that comes under rheumatoid arthritis, which is an inflammatory condition that can develop in your joints, eyes, and urinary tract. The reactive arthritis usually develops following an infection that passes through your gut, revealing itself several weeks to months later. The symptom normally affects young adults, and more commonly in boys than girls. Reactive arthritis is a type of both infection and autoimmune conditions in your body, and comes under the rheumatoid arthritis group. The symptoms include your joints and organs like the eyes and urinary tract. There can be additional symptoms like skin lesions, mucosal ulcers, and enthesitis. Reactive arthritis is triggered by genetics and the environment. The most common infection is the bacterial ones. But other infections can also affect reactive arthritis, such as Chlamydia trachomatis, which has been found to trigger an abnormal immune response, leading to joint inflammation and other systemic symptoms. But more research is needed on the exact reason that Chlamydia trachomatis triggers this condition. However, there are theories that include molecular mimicry and abnormal immune responses. Other bacterial pathogens could be Salmonella, Shigella, Campylobacter, and Yersinia, which have also been linked to the development of reactive arthritis. The Chlamydia trachomatis condition occurs when the immune system reacts to the infection. This is by attacking not only the genital area but also the joints, which leads to joint pain and swelling. This type of infection is a major trigger for this type of arthritis due to its high occurrence globally, especially among sexually active people. Although not everyone that develops chlamydia infection will develop reactive arthritis, doctors should consider these bacteria when they evaluate patients that have joint symptoms after a genital infection. There needs to be more research into how Chlamydia trachomatis causes the reactive arthritis. There is one theory that the bacteria's proteins looks like the body's own proteins found in joints. This could lead to an autoimmune response attacking T. Reactive arthritis caused by chlamydia infection usually shows up as joint pain in a few large joints like knees, ankles, and wrists. It happens weeks to months after the initial infection, which may give you joint pain. You may also have issues like pain when peeing, eye redness, and other symptoms. However, not everyone will have all these symptoms. When the doctor diagnoses you, and the cause is chlamydia, they need to do a thorough examination, which will be blood tests, and medical history, which will include a complete examination of your symptoms and possible exposure to viral triggers. Also, you may have imaging tests done which will help them to look for signs of joint inflammation and structural damage. Imaging studies could be X-rays, ultrasounds, and magnetic resonance imaging (MRI). Tests in the lab can help rule out alternative causes of joint inflammation and confirm the diagnosis of reactive arthritis. To determine the underlying infectious, this is done by a serologic testing. These tests can also check for specific antibodies related to chlamydia and may also look for chlamydia DNA in joint fluid or tissue. They will also make sure there is not another reason for the arthritis before giving a proper diagnosis. Treatment for chlamydia-related arthritis involves taking antibiotics like azithromycin or doxycycline to get rid of the infection. Also, non-steroidal anti-inflammatory drugs can be used to reduce the joint pain and swelling. In severe cases, special drugs may be needed to prevent long-term damage to the joints. Other germs like bacteria, viruses, and parasites can also trigger reactive arthritis. These germs can cause an unusual immune response that leads to joint swelling and other symptoms of reactive arthritis. There are many germs that are connected, such as Salmonella. This type of bacteria can cause food poisoning. The symptoms could be stomach problems like diarrhea and pain. Salmonella can develop into Salmonella arthritis. If you eat contaminated food or water, you will develop Salmonella, which can move from the stomach to your organs, including the joints. Reactive arthritis and Salmonella usually causes your large joints to be pain and swollen. Another type of bacteria is Shigella. This can cause shigellosis, which leads to bloody diarrhea, stomach cramps, and fever. In rare cases, it may also cause joint inflammation in some people. This happens because the immune system may react to the bacteria, but more research needs to be done to fully understand how this occurs. Campylobacter is another type of bacteria that can make you sick. Other symptoms include diarrhea and vomiting. In some cases, it can also cause joint pain and inflammation. Yersinia bacteria can cause foodborne illnesses with symptoms like diarrhea and abdominal pain. They can also lead to reactive arthritis, where the immune system attacks the joints after infection. The last infection is pathogenic infections. These are in widespread areas. Intestinal parasites like Entamoeba histolytica and Giardia lamblia have been linked to the development of reactive arthritis. There are many symptoms of reactive arthritis that include joint inflammation that starts from an infection in other parts of the body. Some symptoms could be conjunctivitis, arthritis, and urethritis. The first one is asymmetric oligoarthritis, which affects the lower limbs, giving you joint pain, swelling, and stiffness. The joints that can be affected are your knees, ankles, and wrists, and can be from mild discomfort in the joints to severe arthritis that can impair your movement. The second one is urethritis. This is usually seen in male patients, and is inflammation of the urethra and is typical with reactive arthritis. Symptoms can include frequent urination, dysuria, and urethral discharge. Number 3, conjunctivitis. Inflammation of the conjunctiva is accompanied by mild discomfort and photophobia. Arthritis and urethritis might occur together, or conjunctivitis can come on first or later. Conjunctivitis usually goes away on its own. Up-to-date lubricants or anti-inflammatory eye solutions can help with symptoms. The treatment of reactive arthritis is to reduce inflammation and relieve the pain. Depending on the results of the tests and the severity of the condition, treatment plans could include: Number 1, antibiotic therapy is to eliminate the underlying infection and stop it from spreading, which will lessen the likelihood of recurring episodes and the inflammatory reaction. Number 2, nonsteroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and indomethacin are a few examples of this type of medicines that are frequently used to treat reactive arthritis-related joint pain, swelling, and stiffness. Or number 3, disease-modifying antirheumatic medications. These may be taken into consideration in situations of severe or resistant arthritis to decrease the underlying immune response and avoid long-term joint damage. Number 4, biologic medicines. These are taken in severe cases that you cannot respond to traditional medication or biologic medicines. These include interleukin inhibitors and tumor necrosis factor inhibitors. But these have severe side effects. Number 5, physical therapy. This can help with your joint function, strength, and keep your joints moving. They include stretches and therapeutic exercises. It can lessen discomfort and improve your general well-being. And 6 is support. If you are dealing with the social, emotional, and physical difficulties brought on by reactive arthritis, you may find help from resources such as counseling and support groups. If you feel anxiety, despair, and social isolation, which is frequently felt with chronic inflammatory illnesses, spending time with friends and family on a regular basis and exercise can reduce these symptoms. Diagnosing and treating reactive arthritis is a complicated inflammatory disease brought on by infections elsewhere in the body and can be difficult for medical professionals to diagnose. Reactive arthritis is mainly caused by a complex contact between your immune, genetics, and viral. The chlamydia trachomatis is the most common cause. However, other bacterial, viral, and parasitic diseases may also play a role in its pathogenesis. Reactive arthritis still needs more research and studies done to find and improve the underlying causes, improve diagnostic techniques, and create more potent treatments. Thanks for watching this video. I am not a medical professional and this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. If you found this helpful, please click the subscribe button to follow my channel and press the bell. If you have any questions about arthritis, please leave a comment below. I hope this has helped you and good luck.